Hi, my name is Robert. I am a vet from Affordable Vets. We're speaking today about lymphoma and leukemia. Now we'll play a game, and that game called Guess Which One. You have 50-50 chance. I like 50-50 chances. I usually give those, let's say, for my either students or either actually the clients. I like to say that 50-50 chance you have. So you have 5 seconds. So, okay. So let's say drop butter or pour milk. Which one is which? Okay. Okay, you had your chance. And the answer is okay. Agreed. So drop the butter is lymphoma. Pour the milk is leukemia. Now, why I chosen those? Because you will remember better. Now, power milk, and what happens? It splashes everywhere, and it's disaster, isn't it? So that is what this leukemia is. It's a disaster, and the disaster because of the those naughty puppies in the blood or small blood cells, which one is actually should be doing something they don't do what they're supposed to do, and the as naughty puppies just multiply like mad, and when they multiply, they don't do anything, and they stuck the whole blood with those cells, and they are coming from somewhere. They're coming from one particular organ, which one is bone marrow. The bone marrow is, let's say, everywhere here, in the big bones, in this case, in the back or the pelvis, in this case. So there is bone marrow, which when those cells, progenitor cells, otherwise called, they become rogue. Okay, and it's little remembrance for the us which and how to classify a little bit. Now, leukemia is the pets usually are very sick, really very sick. And the difference between the lymphoma and leukemia is that lymphoma will be somewhere and leukemia will be everywhere. Okay, so everywhere in the body. That's what I meant. And majority of the lymphoma will be lymph nodes because this disease is lymph node disease. Okay, primarily lymph node disease. Okay, as leukemia is bone marrow disease or bone marrow house disease. Okay, so lymphoma relatively is easy to treat, as leukemia is difficult to treat. And to be truthful, with leukemia, we more have euthanized the pets because there's no helping of the medications, or very usually it's very limited help we can give with leukemia. And it's very unpredictable sometimes. Sometimes we can get really good results and sometimes you don't. And lymphoma is predictable. Okay, especially when you know which type of lymphoma, and there is a lot of types. I will not gonna do that. I will not gonna say which one is the granular or high grade or low grade or any epithelotrophic and so on, so on, so on. And it's like in your head is blah 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 blah. So it's let's not continue on that. Okay, but what I wanted to tell you about today about lymphoma and leukemia is that they are both oncologic diseases. They're both treatable. And a very peculiar fact is that lymphoma can become leukemia and leukemia can become lymphoma. I know it sounds crazy, but yes, it does. In humans, much more often than dogs, but it still does. And treatable, as I say, the same way. It's difficult, but it's possible. Okay. And lymphoma is much easier to treat. Sometimes it's much easier, sometimes it's really difficult, but it's manageable, let's say, as leukemia is not very manageable at all. And my purpose to familiarize to you with those that lymphoma, majority of the cases is in lymph nodes. And when it's in lymph nodes, the lymph nodes enlarged, let's say in the neck or the prescapular lymph nodes, sorry, at the front of the shoulders, at the back of the legs in this case, or in the abdomen. In the abdomen, of course, it's difficult to see, but when you see swelling on both sides of the dog in the neck area, That's for you is alarming sound is straight away. Alarm of the see the vet to take samples to find out exactly. Now, with leukemia, it's sometimes enough to take a blood sample. Fairly enough, you take the blood sample and you see just blood samples like that. I mean, high, not low numbers, but high, not anemia, but very high of white blood cells. Depends on the which type, of course, as well. But majority of the cases is a lot of cells are high numbers, and I usually use here the knowledge called cytology. So cytology is actually you take the blood sample, which you have taken before from the pad, and you do a blood smear on the glass. And that glass you smear do staining on the specific stains which we may have, and those stains we actually dip them, let's say, and we find out in the microscope, and we can check how the blood cells looking. Are they actually looking angry? Are they looking as a cancer, very similar to the cancer, or to lymphoma or to leukemia, or similar? Sometimes only from the blood smear you can find out. So it's very rewarding, but at the same time is a time consuming job for us to actually find out from the blood smear. But if I have a patient with the lymphoma leukemia, the first thing which we always should do is a blood sample. The blood sample is crucial for us to determine. And if we have a swelling of underneath the neck, we can always take a sample, and the sample will tell us. So um, in the future, I believe that in the future we'll able to treat a leukemia better. But how this happens, or how we can do that, is all with going along with the medical or the human medicine. Because human medicine now, they do bone marrow transplant, and that works. Um, Imagine that we would do bone marrow transplant in a dog. That would be interesting, I would say. But again, it's a long way to go, and then, it's not today's talk about that. So let's summarize. Um, if the dog has lymphoma, it's very favorable or guarded prognosis. With leukemia, sadly, still is very guarded and very poor, or sometimes even grave prognosis, which one is not good at all. So keep well. Speak to you soon. Take care. Bye bye.